you package them. Some of these challenges. Number one, take up insurance and there's a dotted line covered for some chronic ailments. And then there's a line of pre-existing conditions that comes in. There are some insurance companies, I don't know whether it's all of them, that would say that for you to qualify for this insurance policy to actually take care of you, should you be diagnosed with a chronic ailment, you have to have been a regular contributor for 3 consecutive years. And by consecutive, they mean if it ends on the 9th of August, you renew by the 9th of August. If you go to renew on the 11th of August, we start from square one. Why bring in so many barriers into insurance? Why does a policy have to be 1 year long?
Okay.
Can there be a monthly policy? Why do the premiums have to be the way they are? Can there be other ways of having these premiums?
Okay.
Why is there so much rigidity in this industry?
That's an interesting question, Eric. And maybe just for context, I think you started with the pre-existing.
What are those, Kwanzaa?
Insurance has continuously evolved. I think up around in the early 2000s, when you went to apply for insurance and you made some disclosures that I have diabetes, I have hypertension, and all that, as long as you've ticked that in the form, God forbid if you said you had HIV, because you remember back in the day it was still a big thing. I'm not saying it's not.
Yeah.
But if you ticked any of those back in the day, you would quickly get your check back. In fact, it at some point felt like being admitted to the Ivy League of schools when you got that policy. But with the support of the regulator, there has been some progress that you don't necessarily have not to be covered just because you have a pre-existing condition. Does it mean you cannot? The answer is it doesn't mean you cannot. As a matter of fact, more people die from accidents than from pre-existing conditions. And so what we have done is, over time, ensured that we are responsive to the needs. So the first thing is, yes, you get covered. Is it to the full limit? It depends with your policy. So what I would encourage many of us to do is to appreciate the detail of your policy. That I might have a cover for 1 million shillings, but my pre-existing has a limit of 500. Why do we want to do that? It is ensuring that we balance off the benefit that we are giving and the premium, and that you don't give a cover and then tomorrow the company also doesn't exist. The country has had a history of some insurances going under because of performance, but we are all past that. So pre-existing now, you'll hardly get back your money because you have a pre-existing condition. It's covered. You did ask about, I think it's what we call waiting time, that I have a waiting time. But for some context, what type of policies do we have in this country? So we have, by and large, 2 bigger categories. Me as an individual, I can buy for myself, and if I have a family, for my family, or my employer can buy for us as a group, which means it's many people together.
Yeah.
When it's many people together, it means we could be 100, and we are not buying because we are sick. It's just there is a need.
Insurance.
Today I might be sick, but there will be 99 others who are not. Which means when on a balance of things, you can be able to pay. Because the most important thing is to ensure sustainability. One of the things to avoid is to give a product which you will pull out because it's not sustainable, because it hurts the confidence of the populace. And so when it is a corporate, today, Eric, when I get you covered with CIC, I hope I sign the contract, you will not need to wait for anything because you're a group and the risk is well spread out. You can access chronic treatment, you can access what we call acute treatment. God forbid if it's you can access.
Okay.
All right? But when now to an individual, and it's not as punitive because once you have been insured, many times it's just what we call a limited waiting period. And it's to just also safeguard that it's not just the sick who are buying. Remember, we are human beings. I could be here with Bwana Maliba, and he needs a surgery tomorrow. He comes today,
Signs up,
pays
pays a small premium.
pays 100K. Tomorrow he's
in
having
hospital with a bill of 5 million.
A bill of 5 million. So it's just some safeguards to ensure that people are insured. But there's such good progress in that space because I think in the industry now, we are having hundreds of thousands, the individuals who are actually buying insurance. At CIC, we see that as our fastest growing segment, where now, because remember, there is a change in how we do things. People are leaving work not to change jobs, but just to do their own thing. But I still want to enjoy a cover the level that I was enjoying. So that's some of the progress that we're making.
We also operate in a bite-sized economy, don't we? A lot of folks,
Kadogo.
Yes, that Kadogo economy. If I were to apply, if I bought a plane ticket today to Paris, I would need travel insurance, right? It's not something I do regularly.
Yes.
But I pay $20, $50. I get insurance. If anything should happen over there while this happens, I'm covered, right?
For X days.
For X number of days.
Yes.
Right?
Yes.
And it's doable. It's done the world over. Would it be feasible to have that kind of insurance in Kenya, whereby people then are the fear of something might happen with this money that I've paid then is removed because somebody knows, all right, I can pay chunks of insurance 3 months and surgery, for example, is coming up. So I've paid for, in smaller bits and that allows it to cover for something.
Yeah.
Is that possible? I know I have surgery in 3 months. Can I pay insurance for 3 months and then get treated and then we see about me doing it later? Is that something that would be considered, and if not, why?
I think that's an area of progress that we just have to, because as you mentioned it's the Kadogo economy. It could be 100K and I am able to pay 30 million. And in terms of investing in innovatively to products that respond to that need. Because the response to that question is the same reason why we don't sell sugar to everyone for 1 kg. I want to buy a quarter kg because that's what I can afford. And I think that's the question. And that's a space that we are, of course, now looking into because we are working towards ensuring that everyone is able to afford. If you're not able to afford because it's too much and I earn my money in a particular manner, because I might be a contractor, it's what I have, that we have a solution for that. And if you're not able to afford because you feel it's a lot, then what do we do? And I'll tell you, Eric, for example, we have a product where an inpatient cover for a certain limit is 2,500. And this is out of the feedback we would get when we engage with our cooperative movement. The same example I was giving, that now I'm sick, I've sold my cow. How can I avoid selling my cow? So, number one, we have now the insurance for the cow itself. If the cow dies, you bring a claim and tell me my cow was called Rachel. She died, and I give you your 75,000. It was a Fresian cow. But then again, if you also now became unwell, I'll tell you, then you can go to the facility for 2,500. So that the whole ecosystem is well taken care of in terms of, because let's look at it, the whole industry is insuring just upwards of 2 million lives, right? Throw in the social insurer, we can still say 70% of us have no sort of insurance.
Yes.
So the potential that there is huge. We have to think about, if we have 55 million and just around 15 million are insured, surely we have to think about these 30 million guys. And in that 30 million guys, I think it's what Ndu is saying, there is one who can pay in a quarterly or in a month, in some sort of way.
Some staggered manner.
In some staggered manner. And those are areas that we are definitely...
And even if you think about it, a majority of hospital visits are outpatient hospital visits.
Yes.
How many insurance products do we have that are specific to outpatient and not including inpatient? Because then, if you had such a product and so I have my outpatient policy and this one goes up to 5,000 shillings, I know what's the likelihood that I'm going to actually spend more than 5,000, So you allow those smaller, like Ndu is saying, bite-sized products to come into the market. So you get more people seeing this makes sense to me and it can work for me. Even my income, my everything, I can afford this one. At least when that person goes to hospital, they are not thinking of today my family will not eat today because I went to hospital and I was told go and do some tests that cost 500 bob, and then you buy some medicine that costs 250. That is 750 bob. That's 750. If I take 750, my children will not eat. But you see, that's 750.
Yeah.
And that's what I was talking about, the rigidity of the insurance sector, that it's still so fixated on the corporate sector that it has not been thinking about the lower cadres, where that's where the majority of the people are, Arnold.
Actually, just to build on that, I think the questions here for the last couple of minutes have revolved around product innovation. And I think the challenge for me, from where I see it, and that would be a question I will really love to hear from you, is that I don't know what the data says, but looks like the insurance actors are so much focused on low-lying fruits. The corporate side can easily put in the money.
And there's a law, there's a law that says that you must provide health care for your workers.
So, those are so quick to go around by. So I don't know how the sector works, but I know that as a country, we are a sick country. People are not going to hospital not because they are well. People are not going to hospital because, number one, they can't afford. But we have got people that are sick. And the product, specifically, since we're talking about health insurance, the product we're offering is the health insurance. Is a social product. And that is why then I go back to what you said, that CIC has got its roots in the cooperative movement. So it's actually tapping, the origin is actually tapping in the pooling power, that when we come together, we are able to work around that. But there are very few products flexible enough that actually are tapping into the informal sector. We agree that the informal sector is now the leading job creator. And it's been so for the last about 30 years, because I'm told the informal sector overtook the formal sector in 1992. Yet, up to today, we still do not have vibrant market-facing products that target that particular sector. Two, I'm yet to meet a health insurance facility that would be as graduated as what we see today in the motor vehicle industry. Today, I can actually pay my car insurance for a month. But every time I've gone to check around my insurance, my health insurance, I'm either paying the whole of it or I'll not have it.
Yes.
So why is it that my car...
and waiting for maybe a while before you can access
So why is it that for my car, which actually is much more...